Please consult your physician, healthcare provider prior to beginning any exercise program. This is especially true if you have not been active for an extended period of time, or if you have any pre-existing health conditions such as heart condition, pains in chest, frequent loss of balance, feeling faint or having spells of severe dizziness, high blood pressure, bone or joint problems, and or leg weakness that could be made worse by a change in physical activity. Please exercise with caution within your own limits. No exercise should hurt. If any emergency occurs, dial 911 or visit your nearest emergency department. By participating in this exercise program, you are doing so at your own risk. Are voluntarily participating in these activities, assume all risk of injury to yourself, and agree to hold St. Joseph's Healthcare London, as well as staff and agents, harmless against claims and or damages related to your participation in this program.
Hi, I'm Cathy, and I'm one of the rehab trainers or kinesiologists with the pulmonary rehab, cardiac rehab, and diabetes program. So today what we're going to do is run you through a variety of resistance exercises. We're going to do some stretches and some balance exercises as well. First things first, we want you to make sure that you have your oxygen on if you normally wear it with exercise. If you have not done a bit of a warm-up, I would suggest you hit pause right now. Go do about a 10-minute walk, whether it's in the house, outside, marching in the spot, just something to get your heart rate up a little bit so that you're not doing resistance training on a cold body. We want to get that circulation increased a little bit so then your muscle tissues get warmed up, your arteries start to dilate a little bit so it helps with circulation. So once you get that done, then click back on and then we'll get started. Make sure when you come back you've got your TheraBand with you ready to go because we're going to start out with the exercises, doing some strengthening. So once that's all finished, come on back. If you've already done it, let's get started. So referring to your exercise brochure that everyone has been given in the program, you know that most of us refer to most of these exercises. We might not do them exactly how they're demonstrated in the brochure, but we do go through pretty much all of them. So the first one I'm going to start with today is your sit to stand. So that's number 1 in your brochure. You can use the chair if you want to, and make sure when you're doing the chair, if you have one without armrests, use that. It's much better because then you don't end up hitting your elbows off the chair. So we're going to start with our feet shoulder width apart. Make sure that chair is behind you. With the oxygen, you want to make sure that you have it turned up to whatever level you should be at. So if you should be using 4 liters of oxygen, then make sure you're up to 4 liters of oxygen. Double check that. Starting with a nice breathe in, and as we sit down, we're going to breathe out. Make sure it's a pursed lip breathe. You can touch your bum right to the chair, or you can just hover above it. We want to do about 10 to 15 repetitions, trying to keep those shoulders upward and not kind of collapsing into that chair. So nice and controlled. When you sit down, you want to make sure that you're feeling those muscles contracting in your thighs. Like I said, we're going to do about 10 of these. If you get tired, stop. Just have a rest. But if you can carry through, carry on. And again, if you can't keep up with the pace I'm going, go at your own pace. And a couple more. And one more should be 10. So with this one, you're going to be huffing a little bit. That's quite all right. Take a second. In through the nose, pursed lipped out through the mouth. That's going to help to decrease, slow that breathing down. And just remember, anytime that you do get short of breath, you want to do your pursed lip breathing. So now that we're sitting, we're going to do some bicep curls. So with this one, if you do have armrest, watch your elbows for it. We're going to step on the center of that band, sitting up nice and tall. Bring that belly button in, shoulders relaxed. Shoulder blades down and depressed, elbows tucked into your side, bring those hands up towards your shoulders, and slow and controlled back down. Bring them up and down. And you're breathing And breathing out. Like I usually say, if you're counting, you're breathing out. So feel free to count out loud. 4, 5, 6. You should be feeling this one at the front of the upper arms. 8, 9, and last one, 10. Good. Again, have a little rest if you need one, but we're going to move and do the triceps. So the triceps are the muscles of the upper arm. So we did the biceps, let's work the back. With that one, I like to grab onto the band in the middle, so you've got it hanging. You're going to keep one hand close to your heart. The other hand, you're going to angle and push down towards the floor. Slow and controlled back up and push down and up. Breathing out and in. 5, 6. Good. You should feel that at the top, the upper arm, every time you straighten it. If you're not feeling it, you're not doing it right. And 2 more. And down. Good. Now we're going to switch sides. I'm doing that because I don't want to hit my elbow. Again, one hand is close to the chest. Other hand comes down to your side and back up. Nice and slow and controlled. Breathing as you go. Good. Try to keep that elbow tight to your side. The only thing that's moving is from the elbow down. My upper arm is stuck in nice and close to my body. And if you guys are wondering which exercise this is, it's number 8 on the brochure. It's done a little bit different, but it's still working the same muscle group. And down. Good. All right, so sitting straight in your chair again, we're going to set ourselves up for the chest press. So with that one, we're going to bring that band behind our body, tuck it underneath the shoulder blades. So you should have it up in that area, and bring it underneath the armpits. Again, sitting up nice and tall. If you want a little bit more challenge, you can stand up to do this one, but you can sit as well. We're going to breathe in and push forward as we exhale. And then slow and controlled, bring it back in. When you bring that band back in, you want to control it. You don't want the band to snap those arms back in. That's going to help strengthen on the way out, but you'll also get a little bit of tricep strengthening coming back in. Good. And pushing forward. Make sure you're breathing. Purse lip breathing if it's starting to get a little bit strenuous for you. And just a couple more of these. Good. And last one. And back in. That's it. All right, let's have one exercise where we're standing and working the lower extremities because we've done 3 for the upper. So we're going to come and use our chair for this one. Okay, so the first one we're going to do is a leg extension. So this one's going to work some lower back and into some glute muscles, some butt muscles. So you want to use the chair for balance, but balance only. You don't want to lean onto it. So nice and tall, fingertips on the chair, starting on one leg, keep it straight, bring it back. You're not going to have a lot of movement. And then back down. Bring it out and down. So as we come back, exhale, come down, inhale. Exhale, inhale. Good. You should note that my shoulders stay over my hips. All the movement's coming from the hip. And a couple more of those. Good. Now you're going to find that the leg you were weight bearing on gets a little tired. Just do a little hip shift and then switch over to the other leg. So again, balance. Bring that leg back. Whoops. And down. Back. Down. That's it. Keep that body nice and straight. I don't want to see any of this. That's not good. This is what we're looking for. Nice and tall. That's going to help with your breathing as well. 5, 6, 7, 8, 9, and last one, 10. Good. Let's come back down. We'll have a bit of a rest because we've been standing for a second. And we're going to do an exercise that's going to work between the shoulder blades. So we're going to wrap the band around our foot with your leg out straight. So you're sitting on the edge of the chair for this one. Grab onto the band down at your knees. Sit up nice and tall. So again, those shoulders over your hips. You're going to exhale. Bring that band in. You'll see that my elbows are straight back. That's your end position. And then slow and controlled back down. So this is working the muscles of the lower upper back. And pull. That's it. 4. So you're just sliding that band up your thigh, stopping at your pockets. 6. Nice and slow and controlled. 7. 8. 9. Last one. Good. So while I have you sitting down, we're going to do another leg exercise, but it's going to work these big quadricep muscles. So those are the ones that are responsible for getting you up off the toilet, climbing the stairs. So we want to keep these guys nice and strong. So trying to sit nice and tall. You can use your TheraBand if you want to with this exercise. I believe in the brochure it does demonstrate with the band on, but for today we're just going to go without. So starting with one leg, you're going to straighten and bring that leg back down. You can alternate between both, but so I don't lose count, I'm going to do one leg at a time. With this one, shoulders over your hips, breathing out. Make sure you're doing that pursed lip breathing, and you should feel it in this big leg muscle. And just doing a couple more. Nice. Give that leg a little rest, switch over to the other side, or continue on if you've been alternating between the two. That's it, good. So those leg muscles, you should feel it contract when you straighten, relax when you come back. Contract and relax. Breathing out and in. Make sure when you're breathing in, you're using that cannula. And last one. Good. So now we've worked those guys. Take your time, have a drink if you want. We're going to stand up behind the chair. I'm just moving the chair sideways so that you can see how I'm doing this next exercise. So this next exercise is, I believe, number 10 in your brochure, the hamstring curl. So starting, we're going to keep our thighs together, knees beside each other, little bit of a toe tap. Bring that heel up towards your bottom, slow and controlled back down. When you bring that heel up, don't bring it up so high that you get a cramp in your hamstring. That's not what we're looking for. Just a slight contraction and back down. Nice and slow and controlled. You want to go at your own pace, but you should be able to feel it. 5, good. 6. They don't have to be fast. You want to have a definite stop at the end, both ranges. One more. Good. Now switch over to the other side. Again, do a little hip shift if you have to. Nice and tall, shoulders over your hips, belly button in. Bring that heel up towards your bottom, back down. And breathing, because we all love oxygen. That's it, good. 5. And again, if you find that 10's not enough, you can do 2 sets of 10 or try to get up to 15. And 10. Good. All right, let's come back to the front of the chair. We're going to do one more exercise to work that upper back area. So you want to grab onto your band in the middle, about chest height. If you have sore shoulders, you can bring that band down a little bit. If your shoulders aren't, you want it chest or eyeball height. So I'm going to start at chest height so I don't block my face. We're going to start with the bands out, slight little bend in my elbows, keep that bend, pull out and pull back. And forward. Feet are on the ground, sitting up nice and tall, back and forward. So always keeping that bend in the elbows. and it's just moving from the shoulders and back. You got it. Good. If you find that difficult to do, like I said, bring it a little bit lower and squeeze in. That's it. Breathing out. That's good. Pursed lip breathing if you find that you're having troubles to maintain your breath or you're feeling short of breath. Last one, and in. Good. All right. So we've covered all the major muscle groups. What we're going to move on to is some balance exercises. So with those, I'm going to get you guys to stand up. We're going to move behind the chair. Almost all the balance exercises are done in standing. So I'm going to toss my band over here. First one we're going to do is a calf raise. So calf raise will also strengthen the calf muscles, but it works on balance. So it kind of gets two different exercises or types of exercise at once. Again, have a chair, countertop, table in front of you, just for balance if it's off. If your balance is good, you can go without. But I usually say put a fingertip to start, get a feel of how you are. If you feel pretty secure, pretty stable today, you can let go. Because when you go up, you want to hold it for a couple seconds and then back down. If you're feeling wobbly while you're up there, that fingertip's not going to hurt to put on there. Remember, safety is number one. So you should feel that in your calf muscles when you're up and then back down. Coming up, hold, 2, 3, and down. So that hold, you can really feel those muscles contracting. And again, breathing as we go along, each movement, breathing in when we come up. That's it, good. We're going to do a couple more of those. And last one, good. The next one we're going to do is a single leg stance. So it's basically just balancing on one leg. I move my chair out of the way. Normally I would have it in front of me, but I want you to see how I'm doing this exercise. So you're going to stand on one leg, lift the other leg. If you find that you're really unsteady, make sure you have your hands on the chair. If you feel that I can maybe go, you can bring your hands above the chair. If you're really brave, bring those hands up over your head. Make it a little bit more challenging, but only do that if you can stand like this for 30 seconds without falling over. So today I'm going to put my finger on the chair. About 30 seconds, and then switch over. If your balance isn't great and you can only hold that stance for 10 seconds, then just do it for 10 seconds. But try to aim up to 30 seconds as you go along. So let's switch over to the right leg, fingertip on the chair, hands on the chair or table in front, no hands, and see how that goes. Good. You want to make sure you bring that belly button in. That helps to maintain your core stability, which helps with your balance. Good. So once that gets better, you can start challenging yourself. But always start with that table in front of you so that you don't fall. The next one I want to do is a tandem stance. So I'm going to turn sideways so you can see how my feet are placed. And I apologize about my shoes because I wore them outside. So one foot in front of the other, and you just want to stand in that position. Again, you're balanced. Chair is there if you need it. Countertop. If not, let go. Progression for this one, you can rock up to the front and then rock to the back. Rocking up to the front, do that about 5 times, and rock to the back. And back. Good. Now let's switch. Bring the other foot, in front of the other. Okay? The toe is touching the heel so that we have a very narrow base of support, like we're standing on a tightrope. Fingertips if you're very wobbly, hands at your side if you're not. And if this feels really comfortable, you can challenge yourself and rock forward and back. Again, about 5 times going forward and back. But again, if this feels really unstable, put those fingertips on the chair. That's it, good. We're just shifting that balance, that center of gravity forward, center of gravity comes back. So it challenges our balance system. Balance becomes important after the age of 40, especially in seniors, because we don't want anyone falling at home. Now the next exercise that I'm going to have you do is standing with your feet together. Okay? Again, you've got your chair in front of you. So feet together, and then I want you to close your eyes for about 30 seconds. The reason why I want you to do that is because now I've taken away one of your senses. Balance is your feet, proprioceptors, your ears, and your eyes. So if we close our eyes for 30 seconds, then your ears and your little proprioceptors and your feet, knees, and hips have to work harder. So this one's really good to work on. You want to try to do it for about 30 seconds if you can. You'll feel that you start to wobble a little bit more, and that's okay, because that just tells us that those other senses are having to work a little bit harder. So once you get to your 30 seconds, which I should be close to, you're going to open up your eyes. And just stand there for a second, because now we have to adjust to the light coming in. Good job. All right, so that is some of the balance exercises. You should try to work on these balance exercises every day, okay? We want your balance to be key, okay? So the cardio daily, the strengthening exercises 2 to 3 times a week, and then these balance exercises every day. So let's move on to some of our stretches. So I've got everybody standing. Let's move on and we'll do a calf stretch. With the calf stretch, you're going to stand one leg forward, one leg back. Heel stays on the ground. You're going to lean forward onto this front leg, keeping that heel down. You should feel the pull in the back of the heel. Stretches should be held for about 15 to 30 seconds. You can do them a couple times each side at home. Here I'm going to show you one time each side. Okay, keep that heel down, and then stretch over to the other side. Again, that heel stays down, leaning forward till you feel that pull below the knee. If you get pain when you're doing this one, don't lean forward as far. Take a little bit of stretch off. If you don't, you want to get a good stretch into that calf muscle. Again, for about 15 to 30 seconds, the longer the stretch, the better the stretch. The next one we're going to do is stretching these quadricep muscles, these big guys, the ones that were working when we were doing our sit to stands and our leg extensions when we were sitting down. When we do that exercise, hang on for balance. We're going to try to grab onto that heel and bring it up behind us. I know that not everybody has great knee range of motion, so the other way to do that is using a chair or a table. Bring your foot up, stand up nice and tall, lean back slightly. You're still going to get a stretch into that quadricep muscle. Hold that. Again, if you don't have the chair, you can always walk that foot up the wall to get that stretch as well. Good. Switch over to the other side and lean back. And if you can grab onto that ankle, bring that leg up behind. Holding for about 10 to 15, 20 seconds, 30 seconds is even better. Good. All right. Moment you've been waiting for. We get to sit down again. We're going to stretch the hamstring muscle. With that stretch, you're going to sit on the edge of the chair because we want to make sure we can get that leg out straight in front of us. Toes pointing up to the ceiling, shoulders over your hips, nice tall torso. You're going to bend forward from the hips. You're going to feel that stretch in the back of the thighs. It's not a contest to see if we can touch our toes. You want to feel that pull. Hold it. Make sure you're breathing. Good. And then back up. Switch over to the other side. Leg is out straight, toe is up, and lean forward. Feel that pull. Again, make sure you're breathing while you're stretching. I know sometimes it's easier to hold our breath because it hurts a little bit. You don't want to. You want to make sure you're breathing throughout. Do your pursed lip breathing. In for 2, out for 4. Good. All right, so we've done the calf stretch, the quadriceps, and the hamstrings. Let's move up and stretch some of the body that we also work, the upper body. So the first one we're going to do is grab your hands together. You're going to push your hands down towards the floor, stretch those muscles between the shoulder blades. You're going to hold that, and again, this one, it's sometimes hard to breathe while you're doing it, but you want to breathe. Again, holding it for about 15 to 30. Good. And this one's one of those good hurt exercise stretches, because the longer you hold it, the more you can feel those muscles relaxing and pulling. All right, bring those shoulder blades back and down, hands come out to the side, and bring the arms back. This is stretching those muscles in the chest area. So again, you want to hold that for about 10, 15, 20, 30 seconds. Good. And bring that down. In the brochure that we gave you, it shows going up against the wall. Same stretch, same area, just done a different way. The next one we're going to do is stretching the back of the shoulder. So you don't want to bring that arm across in front, other hand comes behind the elbow, and just pull it across in front of your body. This one you should feel in the back of that shoulder. Make sure you're sitting up nice and tall so you get the best stretch. And holding it for about 15 to 30. Bring that arm down, switch over to the other side. Good. And again, if you don't have great range of motion when you're doing these stretches, only take it as far as you can take it and hold for as long as you can. And bring that arm down. The last one that we're going to do with the arms is the tricep stretch. Now I know a lot of people have challenges with this one because of shoulder range. Hand on the same shoulder, just push that elbow up as far as you can. Now if you can take that hand behind the neck, grab on and pull it across. And that's going to get that stretch in the tricep area. Again, only do what your body's going to let you to do when it comes to the stretches. Good, and bring that down. So again, if you don't have great range, just take it as far as you can. If it will go further, bring it up and over so that you get that stretch into the tricep. That's it. And release that one. Good. Now, a couple exercises for your neck, or stretches I should say. Relax those shoulders down, bring that ear over to the shoulder. You're going to feel a good stretch on that opposite side. Let the weight of the head dictate how much pulling is going to go on in that neck. Again, if it hurts, pull it up a little bit. If it doesn't, just let the head come over to the shoulder. You'll notice my shoulders are staying level. I'm not bringing them up. I'm not trying to cheat. Bring that head back up and over to the other side. Keeping those shoulders nice and level and stretching into those trapezius muscles. That's it. All right. Another one that's good to do, especially if we're still driving, is a rotation, because we want to make sure that we can still shoulder check. So you're going to look over that shoulder just as far as you can. Again, getting a bit of a stretch in the opposite side, holding it for about 15 seconds, 30 seconds. Seeing if you can see what's in the back corner. Back corner of your house, and then come back into the middle, and then over to the other side. These ones should always be done nice and slow and controlled. And then back to the center. Last one that I want you to do is some nice big shoulder rolls going backwards. Really loosen up those joints. This is a dynamic stretch versus the others were static stretches. This one you can actually move through it and then go forward. The other ones we were holding. You definitely don't want to bounce through your stretches. And relax. Good. Now, also don't forget some of the stretches that we did before for your diaphragm, for your ribs. I'm going to go through 4 or 5 of those really quick just so that you have some guidance for those. One that we usually work on when you're at St. Joe's is the apple picking. So you're going to reach across grab your apple and put it down into your basket. Reaching across, grab your apple, put it into your basket. Remember, these are great exercises on those yellow or red days where you're having troubles breathing, working on trying to expand that rib cage. Go the opposite side, grab your apple, and come down. Reaching up, really feeling those rib cage open up as you come across. That's going to help to expand the rib cage, allowing you to get a little bit more air in. Last apple, and back down. Good. The other one that I want to go through is your beach ball turn. So sitting up nice and tall, feet flat on the floor again, sitting on the edge of the chair, grab onto your beach ball in front, rotate that ball over, really get a stretch through that ribs, come back, rotating down, and back up. Good, make sure you're breathing. One more time each side. That's it. Last one. Good. All right, one more, and then we'll call it a day. Opening and closing the curtains. Easiest way to remember this one. You're going to start with your hands out. You're going to open those curtains, turn the hands, and then close the curtains. So see what the neighbors are doing? Yeah, not that interesting. Close those curtains up. That's it. Open the curtain and close the curtain. Remember, these are really good to do when you're having troubles breathing. And open the curtains. Some people have troubles on those really cold, damp days, which we're having a lot of. And close the curtains. Good. Excellent job today. So, take-home message. You want to make sure that you're doing your strengthening exercises with your TheraBands about 3 to 4 times a week. Doing your cardio every day for up to 30 minutes. If you can't do 30 minutes at once, then you want to break it up into 10-minute sessions. Have a little break in between. When you're finished your cardio, do your strengthening, then do your balance exercises and your stretches, okay? Make sure when you're doing any exercise, it should be pain-free. Make sure you have your oxygen on, if you're supposed to be using oxygen, and make sure you have fun while you're doing it. Thanks.